what we know about patients with relapsed and refractory multiple myeloma is that they really, they're in a bad place. They've really run out of treatment options and outcomes are poor. There's a couple of publications that are out there now that show in those patients who are triple refractory, their median survival is likely less than 12 months, and indeed probably even worse than that. So, we've really seen a significant advance in treatment options over the last decade plus with PIs, with IMiDs, and with daratumumab in terms of CD38 compounds as well. But what we now know is that in those patients who have really exhausted those therapies, outcomes are poor. And in particular, those patients who are refractory to the last lines of therapy and a triple refractory, we know outcomes are poor. And there's a critical need now for new therapies to address these patients' unmet need. At ASH 2019, Dr. Maduri presented the very first results from the CARTITUDE-1 study. And there she presented the phase 1b data initially. Those initial 29 patients. And the data really at that time were spectacular. 100% response rate, a very, very high stringent CR rate, and the durability at that time looked extremely promising. At ASCO in 2020, Dr. Maduri presented an update of those data, really with longer follow-up, and the data continued to look very good. But I think the key data set that we were waiting to report on was the pooled data from the phase 1b, phase 2. And that's the first 97 patients. And that is the pivotal data set for Cilta-cel, which we have now actually started the rolling BLA submission for. And you can really now start to understand more broadly the potential efficacy and safety profile. So first of all, the phase 1b portion confirmed the dose at 0.75 times 10 to the 6. So it's a relatively small amount of CAR T cells that we infuse in patients. And I think that's important, and I'll touch on that in a moment. That, one of those things that we tend to look for in CAR Ts and understand is the cytokine release, because that's really almost something that you see as you see these CAR T cells expand in the patient. And we saw 95% of patients having CRS, but almost all of it was grade 1, grade 2. Importantly, the median time to onset for the CRS was 7 days, and that's unique. And we talked about this earlier in terms of how Cilta-cel is a differentiated CAR T. We also talked about how we have a relatively low dose. We see that what happens is we see these CAR T cells expanding over time, and that median time to CRS is really kind of coinciding with that peak expansion. So we see kind of this nice slow expansion. We also know that the types of CAR T cells that we see are these memory types of T cells, which we believe are very important in terms of creating long-lasting immunity as well. And so that fact that we see that median time to onset at 7 days likely suggests that many patients, hopefully commercially when they get Cilta-cel, will be able to get the infusion and perhaps be able to leave the hospital and then come back at a subsequent time point when they see typical signs and symptoms of CRS, which is typically an increase in temperature. From an efficacy perspective, we saw that original 100% response rate with the 29 patients. Now in this almost 100 patient group of patients, we see an overall response rate of 97%. And I think really impressively, we see a stringent CR rate of 67%. That means the complete absence of cells within the bone marrow, normal free light chain, the immunofixation kind of thing that you look for is gone away. And we know that stringent CR is correlated with better overall survival. From an ITT perspective, 55% of patients were MRD negative. But if you actually look to those patients who are valuable, so those patients you can actually measure it, 93% of patients were MRD negative. So we're seeing very deep responses, which that deep response I think is particularly impressive. And the 12-month PFS rate is 76%. 12-month OS rate is almost 89%. And in those patients who had the best responses, those stringent CRs, the PFS rate at 12 months is 84%, which I think is particularly exciting. And we mentioned this right at the beginning. In these types of patients who've had this number of levels of therapy, median survival is probably about 9 to 12 months. At 12 months, 76% of patients are still progression-free. that's really starts to speak to the potential transformative nature of the efficacy that we have seen with Cilta-cel.